Hello, my name is Dr. Ken Anderson, and I'm here in one of the operating rooms at the Anderson Center for Hair. And today, I'd like to talk to you a little bit about lasers, specifically laser therapy for the treatment of male and female pattern hair loss. A lot of patients, when I talk to them in consultation about using a laser cap, sometimes I get some confused looks like, what does that really do? Well, today I'm going to review with you what it does and why it works, and review some medical literature talking about that. So first, I want a little interesting demonstration to prove to you that there's something special about red laser energy and the way it affects and interacts with human skin. Okay, what I've got here are two laser pointers. This one is red and this one is green. Now, I'm going to use the red one first, and you've probably done this at home, or if you had a red laser pointer, probably fooled around with it and put it on your finger. What happens, and your whole finger kind of lights up. You can see that you can see, yeah. Now, a lot of people think, it's the laser energy shining through, it's shining through and lighting up your finger. Well, let's try that with the green laser pointer. If the light was just shining through, then you would expect that when I press this button, my finger would light up green. And I ask you, and you can ask yourself, do you think my finger is going to light up green when I press this button? Well, let's find out. No. You can see the laser is on. You can see I'll put my finger I'll keep my finger on the button, my finger on this laser. Nothing, not a smidge of green comes through the finger. It doesn't light up. And so what I'm proving to you is that the light is in fact not shining through. Okay, the red laser energy contained within this laser pointer is actually stimulating molecules in my finger to themselves glow, that my finger itself is glowing. It's not shining through. It's molecules in my finger are emitting light. They are being stimulated by the laser energy. And what is happening here is the laser energy, and what happens to the tissue of the tip of my finger when I'm doing that, and what happens to your whole scalp. When you're wearing one of these laser cap devices, your whole scalp glows like my finger was just glowing. The effect of that laser energy energizing the tissue is to essentially speed up the metabolism of the cells in the tissue. Namely, it'll speed up the cells of the hair follicles. It'll speed up the cells of their stem cells. For the doctors in the audience, the actual mechanism of action is that the laser energy cleaves nitric oxide moieties off an enzyme in the Krebs cycle called cytochrome C oxidase, unencumbering the enzymatic processes within the Krebs cycle, speeding up cellular respiration, or what general people call cellular metabolism. And as I say to my patients, it's kind of like sending your hair follicles to the gym for a workout on the elliptical or the treadmill or whatever exercise equipment your hair follicles prefer. So that's sort of the effect of it. And then really just kind of like going to the gym, it's that daily stimulation of the hair follicles and their stem cells that achieves the effect. At a minimum, what we're expecting from daily use of a laser cap is to appear to dramatically slow down or stop the hair loss at a minimum. Some patients are going to grow some hair and experience an increase in hair shaft diameter and hair follicle density on the scalp, but not everybody. At a minimum, we'd like to see no change. Some patients in consultation, they'll give me a skeptical look and they'll tell me they're going to go home and do their research. These are not doctors, and so let me help you. I did a literature research. I've got in my hand 13 papers from peer-reviewed journals. These are all studies about the laser cap device, whichever one you pick. And I've got 3 of them on top. I will tell you right off the bat, I could not find a single study in the medical literature that was equivocal about the laser cap in terms of its treatment of hair loss. I could not find a study that said that it had a negative effect. The first 3 studies, I'm just going to talk about 3 of these studies very briefly. They're all efficacy and safety studies about and they are randomized, sham device controlled, double-blinded studies. This is the highest level of statistical control that you can have for a study, because basically they're using sham devices. So patients don't even know if they're using real laser caps or not. Here's what they said in the conclusions. We observed a statistically significant difference in the increase in hair density between the laser device and the sham laser device subjects. No serious adverse events were reported. Our results suggest that low-level laser treatment is an effective option to treat pattern hair loss in both men and women. Fairly straightforward. Here's another one. Efficacy and safety, a 24-week randomized double-blind self-comparison sham device controlled trial. Okay, not an opinion paper, an actual 24-week study. Their conclusions. This study demonstrated a statistically significant increase in hair coverage, hair thickness, and hair counts in male and female patients. This one is a 16-week study, multi-center, randomized, double-blinded, sham device controlled, and this one basically had similar findings. Real briefly, in this study, a helmet-type laser device showed a significant effect on increasing hair density and hair thickness in male and female pattern hair loss. Here are 10 other studies. Sometimes patients ask me about them. I can send you those if you like. So it's not a question of, will this work? Does it work? It works. The technology for the treatment of male and female pattern hair loss has actually been cleared by the FDA, the American Food and Drug Administration, since 2007 for the treatment of male and female pattern hair loss. And there are a number of devices, okay? There are a number of high quality devices. This is the OXO cap, the Capillus cap. This is the one by Laser Cap, the original, the OG, if you will, of laser caps. It's just, the brand is called Laser Cap. And you'll find they all have these little laser diodes in there. I would caution you, there are many sort of off-brand caps available online that are much cheaper. I would caution you against those only because of my experience with them. We had a patient come in and tell me that, that he found one, for $600 that had the same number of lasers as, I think at the time, as a few years ago, as a Capillus cap. I said, well, bring it in and let's check it out. And so he brought it in. We took both of the caps into a darkened room that had a big white wall. They were both fully charged. And I just simply aimed the cap at the wall and we turned it on, and we both observed how much energy, how bright were the lasers coming out of these caps. And so I with the patient, we stood and we did it together. I held up the Capillus cap, and it was quite bright. We held up the $600 off-brand one, and it was noticeably less intense. And in fact, the patient was just like, wow, that's a big difference. I said, yeah, it's a big difference. So be cautioned about that. Anyway, this is Dr. Ken Anderson here at the Anderson Center for Hair. And if you have any questions or comments, please drop them below. And thank you very much. Thank you very much for your time. Have a great day.